Hello everyone. Today's topic is on acute otitis media. Let us see the structure of the ear first. The ear can be divided into three parts: external ear, middle ear and inner ear. Today's topic, the middle ear, is most important for us. For the normal functioning of the middle ear, we need two things. The first point is, the middle ear should have normal, intact, small tree bones. The second point is the presence of air. Where does the air come from? The air, it comes from the nose. There is a tube which connects from behind the nose to the middle ear. This is called the eustachian tube, as you see in this picture. So, for today's topic, that is the middle ear infection, otitis media is related to the infection of the middle ear. If it is virus, it is called as viral otitis media. If it is bacterial, it is called as suppurative otitis media. So, the first topic is acute viral otitis media, which can be defined as infection of the middle ear cavity by a virus which follows an upper respiratory tract infection. It is most common in children. And as I have already mentioned, the causative factor is virus and the common one is influenza virus. Coming to the symptoms. Since the patient is a child, the person to complain will be mother. Mother says the child has had upper respiratory tract infection like nasal discharge and nasal block. And after a gap of 2-3 days, he has developed ear pain. That is the most common complaint. So at this stage, when the child is brought to us, when you examine, the eardrum looks red. Here I have shown a normal looking eardrum so that you can understand and how the eardrum looks like in a case of otitis media. It will be red and it will be bulging. So you don't need any investigation at this stage and you can go on directly to treatment, and that too is very simple. Just painkillers and treatment for upper respiratory for infection like nasal decongestion, which has to be given for 5 to 7 days. This will take care of acute viral otitis media. Now coming to the next topic, that is acute suppurative otitis media. As I have already mentioned, here it means there is infection of the middle ear cavity. Instead of a virus, there is a bacteria here and it results in the formation of pus. That is acute suppurative otitis media. How did the bacteria reach the middle ear? It can access to the middle ear through three main routes. That is, one, following an upper respiratory tract infection through the eustachian tube, it reaches the middle ear. Second one, if there is a prior hole or perforation in the tympanic membrane or the eardrum already, through the eardrum it can reach the middle ear. And last, through bloodborne. These are the three common routes of infection, the most common being the first one through the eustachian tube following an upper respiratory tract infection. For ease of understanding, let us divide the presentation in two different stages, that is early stage and late stage. In the early stage, the complaint from the mother will be the child had upper respiratory tract infection, that is nose block and watering from the nose, followed by an ear pain, which is moderate to severe. At that stage, when the child is brought to us, on examination, you can see the eardrum is red in color and it will be bulging too. This is a finding at this stage. So here, at this stage also, we don't need any investigation. We can go on straight to the treatment, which is simple again, which is going to be a painkiller along with nasal decongestion drops. That is a treatment for this stage. But at this point, I would like to tell you that in some conditions, we need to give antibiotic on day 1 itself. Which are these conditions? One is when the child is less than 6 months of age. Second is when the child is less than 2 years with both ears involved. Third is child has got recurrent ear infection with a history of recurrent ear infection. Fourth is the child has got an immunological problem and he has got a high fever. In these conditions, we don't wait. We start antibiotic on day 1 also. And one more thing I want to convey, that normally even though if it's a first attack and it doesn't subside after 2-3 days and it gets aggravated, even in this condition from the 3rd day antibiotics can be given, but not on day 1 anyway. So it can be treated with just analgesics and nasal decongestion. So now from the early stage, if it is not treated properly, it goes to the late stage. So how does the late stage present? Here in the late stage, you can see that the child starts getting ear discharge. The ear discharge initially will be blood stained and to be followed by pus discharge. When the ear starts discharging, the ear pain decreases. When the child is brought to us at this stage, we do a proper cleaning of the ear. We put in a camera in the ear to show you parents that the tympanic or the eardrum has got a small hole and the infection from the middle ear is coming out, is pouring out. As I have shown in this picture, the small perforation, hole which we call as perforation. So at this stage, do we need any investigation to be done? Or should we go on to treatment? Usually at this stage, in the first episode, we don't need any investigation. We can go on directly to the treatment. But if it is a recurrent ear infection, we need to do a few things. First is we have to take a swab of the ear and send it for culture sensitivity. For what? We have to know which bacteria is involved, and if so, we can know which specific antibiotic can be given against that particular bacteria. The second test will be hearing test. And third test is, since it is recurrent, we should know is there any other causative factor for it. Like there is any adenoid which is seen behind the nose, which is common in children. So we have to do an X-ray adenoids too. So these are the 3 common tests which has to be done. And one more point I need to convey. If the patient happens to be a child of less than 2 years with recurrent infection, we need to do his immunoprofile also to know whether his specific IgA level has altered or not. It is not common, it is rare. Now, let us go to the investigation. Coming to the, let us go to the treatment. Coming to the treatment, the most important treatment will be a thorough cleaning of the ear discharge with suction under microscope if possible, so that we can prescribe antibiotic ear drops. So first point will be suction cleaning of the ear. Second is antibiotic ear drops, 3 drops 3 times daily for maximum of 5 to 7 days as prescribed by your family ENT doctor, and if necessary a painkiller, and of course you have to give nasal drops. I said nasal decongestion to try to make the child more comfortable. So that will take care about acute suppurative otitis media. Now let us see how do you prevent this condition so that it doesn't come back again. Whenever you have recurrence, we should know that there is a cause for it. So to prevent, what are the advices? When the patient is less than 2 years and breastfeeding is going on, it means the technique of breastfeeding is not proper. That's what it means. So we have to advise the mother that she has to sit up and the head of the child will be propped up so that it will be inclined, and that is the proper way of breastfeeding. And after breastfeeding, she have to do barbing also and then make the child sleep, not before that. The second point is, whatever the age group is, whenever there is a perforation and the child is going to take a bath, you have to plug the ear with a cotton wool and followed by application of Vaseline over it, so that you can prevent the entry of air or entry of water into the ear. If water enters through the ear, it can lead to infection. That is the second point. Third and the last point is, whenever the child has got an upper respiratory tract infection, please do not neglect, give early treatment so that it doesn't spread to the ear. So in this whole 5 to 10 minute slide, the most important slide for the parents is this one, take home message, that is, you have to use a earplug whenever you give a head bath and treat upper respiratory tract infection immediately so that the small hole in the eardrum, it closes early. As I have shown in that, whenever there is a perforation, it takes time to heal. It usually heals within 6 weeks. So your review or a follow-up but to the doctor will be after 6 weeks. The child will be seen again. The doctor will put in a camera in the ear and he'll show you that ear perforation or the hole has closed, and he'll do an hearing test and prove to you that hearing also is normal. So this is in short about otitis media. Thank you so much for watching my video. Please, if you like it, please do not forget to subscribe and press on the like sign, please. Thank you so much.